Good morning, everybody. Today is a mixed day for New South Wales. A good opportunity, a wonderful opportunity to be at this brand new hospital precinct in Westmead, but we also know that as we speak, there are literally tens of thousands of people across the state on tenterhooks because of the flood situation, and I just wanted to give the community a brief update. So far, the SES has been called out at least 8,000 times. There are around 15,000 people who've been evacuated from the mid-north coast from their homes. In the Nepean and Richmond Valley region or Hawkesbury region, there have been about 3,000 evacuations to date. 19 evacuation orders have been issued and potentially more to come. We just ask everybody who are in those flood areas to please be cautious, please listen to the orders, please be ready. If you've been asked to be on alert, make sure you're packed and ready to go in case you do need to get evacuated at short notice. We are asking people to please, firstly, get in touch with family and friends if you can stay with them. And if you can't, we'll obviously provide you emergency accommodation in one of those evacuation centres that we have up and running. But as you appreciate, we need to be COVID safe, in addition to making sure that we provide people with the basic amenities they need to get through. 34 areas or 30 up to 38 areas have already been regarded as natural disaster areas, which means people in those communities and local government in those communities can get assistance. That means up to $1,000 each for adults and $400 for children. And we thank the Commonwealth Government for working with the state government and making that available. The situation is evolving. The heavy rainfalls are going to continue, and we are now seeing alerts issued for weather warnings for the Illawarra and South Coast. So whilst we're very concerned with parts of the mid-north coast, especially around the Kempsey area, obviously the Nepean Hawkesbury area around the Windsor communities as well, there are also now alerts being issued for Illawarra South Coast. I want to stress to the community that the New South Wales Government is taking a very holistic approach. All of our agencies are working together, and all this week I'll be based in the mornings from Homebush, unfortunately a common site for dealing with statewide issues. So all of our state agencies will be gathering at Homebush in the mornings to make sure that we're working together and that I'm updated on every situation across the state. And I just want to say to everybody across the state who is currently living in fear and anxiety that all of us are thinking of you. Some communities who were battered by the bushfires are now being battered by the floods, and deep drought prior to that. And I don't know any time in our state's history when we've had these extreme weather conditions in such quick succession in the middle of a pandemic. So they are challenging times for New South Wales, but I think we've also demonstrated our capacity to be resilient. But I know for many people, they will feel like it's breaking point. When you've been through 3 or 4 incidents which are life-changing on top of each other, it can make you feel like you're at breaking point. But please know we're thinking of you, and we're getting support as much as we can. In terms of the weather conditions, because they're ongoing and very challenging, we ask people to be cautious and safe. But also, as Dr. Chant will emphasise in her report, there are parts of the state heavily impacted where people are stranded or have to stay at home or be ready to evacuate. But other parts of the state, please know that if you've been booked in to get a vaccine, it's important for you to get vaccinated. So all of our Sydney locations are still up and running. We suspect the Nepean one is up and running, but we suspect people might not be able to get to them. But if you are able to access safely, please continue to get vaccinated. Most importantly, if it's safe for you to do so, please make sure you continue to come forward and get tested if you have symptoms, or stay at home until you can safely get tested. It's really important for us to keep functioning as much as we can during these difficult times. Obviously, whilst many communities are impacted adversely by the extreme weather conditions, those of us who can move around safely to do those very important tasks should continue to do so. Just in terms of the vaccine, I just wanted to update that last week 27,000 people in New South Wales received the vaccine. 8,000 of those were second shots. So in total, New South Wales has issued 65,000 vaccines in 4 weeks, which is a very good effort. Again, 8,000 of those are people who are getting the second shot of the Pfizer. and we're already starting to commence vaccinating the families of quarantine workers. And whilst the flood situation is obviously top of mind for us, so is making sure we roll out the vaccine program as far as the state government's concerned. We're also meeting as per usual on Wednesday to discuss further easing of restrictions given where New South Wales is in this. It's really important for us not to just focus on one thing the state's being challenged with at the moment, but to make sure that we continue to support the community in many different ways, so that in the next few months and weeks we're able to be in as strong a position as possible. But as we know with all natural disasters, it's obviously very scary for many people across the state today as the weather conditions continue. The best advice I had from Commissioner York, which I spoke to just before this press conference, was that we are expecting heavy rainfall until at least Wednesday, potential easing by Thursday, but it depends which part of the state you're in. So whilst in some parts of the state the rainfall may ease, it will actually exacerbate in others. And as I said, there are alerts now for the Illawarra and South Coast. And parts of Western Sydney and the mid-north coast are still experiencing that heavy rainfall condition. But can I also turn our attention to everybody here at Westmead Hospital. This is a fantastic symbol of what the government's been able to achieve even during challenging times, to invest in our clinical services building, a whole complex, a $1 billion precinct, which will not just be a health centre of excellence but also an education centre of excellence, is an outstanding achievement. I wanted to thank everybody involved, to Minister Hazzard and the health infrastructure team, and to all those third parties as well who've supported the government in this effort. I'll now ask Dr Chant to give us a very brief COVID update, Minister Hazzard to talk about the Westmead Hospital precinct, and then I'll take any questions. Thank you.
Thank you, Premier. So New South Wales recorded no locally acquired cases of COVID in the 24-hour period, and there were 5 new cases acquired overseas. There were 8,337 tests were reported to 8 p.m. last night. I appreciate the weather has been quite inclement, and really appreciate the fact that people are still coming out for testing. It is critical at this point for people to continue to come forth and test if it is safe to do so. We're currently treating around 55 COVID cases, none of whom are in ICU. I'd like to also update you on the investigation associated with the security guard exposure in the quarantine hotel. We have not had any further cases associated with that. Obviously, we've got probably another week to run in terms of those community exposures, but can I thank the community and for the quarantine staff in responding so positively to the public health requirements to isolate and get tested. Thank you.
Well, thank you very much. And obviously, on what is a very serious day across our state, there is still the joy and light of what's going on here at Westmead. I'd like to start by acknowledging the Barra Medical people of the Eora Nation, just thank them for their custodianship of land on which this new incredible hospital facility has been built. I think it's fair to say that there's been a lot of work go into this new $1 billion Westmead Acute Services Building, Central Acute Services Building. I want to start with the staff here. Obviously, the clinical services plan required all of the medical staff here to work very hard to determine what was needed going into the decades ahead. So thank you to all of the staff, the medical staff who put together the clinical services plan. I want to thank Health Infrastructure for working with the builder Multiplex for doing what is an amazing job here, an amazing job. I also want to acknowledge Belinda Hutchinson here from Jack Chancellor of the Sydney University and the Vice Chancellor, and other esteemed guests here who are involved not only in the delivery of health services here but also research. So Roger Riddell from the Children's Medical Institute and other colleagues involved in research. This new $1 billion facility is right smack bang in the heart of growing Western Sydney. This is a massive enterprise that will deliver health services for decades to come to what is the most significant area of growth, that is Western Sydney. Thank you to each and every one of the staff who are now working here. As I walked around with Professor Rob Dennis just a few minutes ago and spoke to the staff, looked at the facilities, what I did see was smiles. Smiles everywhere from staff and guests. Otherwise known as patients. One lady up on the 9th floor, I think it was, described this acute services building as being akin to a 5 or 6 star hotel. And I do think that that is an exciting way to be able to come in and have your medical care in what is an incredible facility. The building, of course, not only is providing massive new health facilities, including new, I think, 25 digital operating theatres, new imaging departments, 300 beds, separate facilities for families to be able to come and stay in those rooms, and much more. But it's also providing the nexus, the connection between education, research and health. This truly is 21st century health, where researchers can be at their bench, and before you know it, the decisions will be at the bedside. So I want to thank everybody who has been involved in delivering what is an incredible facility. Interestingly, you can also see the stadium, you can see the mountains, you can see the city when it's not raining. And I think, as one patient said to me, that also just tends to make you feel that much better when you're trying to heal. So again, thank you to all of the research teams that have worked with us, the health staff, the builders, the architects, the project managers, and of course health infrastructure. This really is a $1 billion centre that will lead us on for decades in terms of the west of Sydney. Thank you.
Questions?
Premier, the floods. It seems the Nepean River is, the flood levels are coming down somewhat. What does that mean for the Hawkesbury region?
Well, clearly that depends on whether the forecast rainfall materialises, and we are not out of the woods at all in that precinct, in that community, and it's really important for everybody to follow those instructions. You might be asked to evacuate if you're on alert already, so we ask everybody to please follow those instructions. And weather permitting, I never want to get in the way in these situations, but I'm intending to go up and have a look through from the air today on the Nepean Hawkesbury to see what the situation is and what's likely to evolve. Commissioner York will be making her way to the Mid-North Coast tomorrow to make sure that she's on the ground in that community. So we appreciate the challenges that exist. There are multiple challenges, and we are, so far the forecast weather conditions have been very accurate, but obviously we need to wait to see what evolves in terms of future risk. Already 3,000 people have been evacuated from the Nepean Hawkesbury precinct, and that number could go up. And we're not out of the woods yet, and we'll just ask everybody to continue to listen to the alerts and also to be ready if you've been asked to be ready and packed up.
When are you expecting the Nepean River to peak, the flooding to peak in the Hawkesbury region? Will it be on Wednesday or Thursday when rain's easy? Will it take longer than that?
Yeah, well, I think it depends on the amount of rainfall that we get, and often, as you know, sometimes the peak can occur after the rain has stopped. So sometimes, depending on where you are, you could experience those peak flood conditions post the rain stopping. And so obviously it's an evolving situation, and we'll give community updates as soon as we receive them. We ask everybody to be alert in that respect. That's why we're setting up our operations centre in Homebush, to be able to have timely information across the state. It's not just the Nepean Hawkesbury we have to keep our eye on. The Mid-North, there are parts of the Mid-North Coast we're extremely worried about, including Kempsey and Taree in those regions. And now we've got alerts for Illawarra and South Coast and parts of Western Sydney. So it's important for us to make sure we're not taking our eye off the ball in any part of the state, and also to make sure that we monitor both weather conditions and also rainfall, and also likely direction of where those peak river conditions are likely to be as well.
Are you going to ask the federal government for ADF support?
Well, we've already had those conversations. I've spoken to the Prime Minister a number of times. Often when we need ADF support is in recovery. So whilst there's a crisis on, can I firstly thank the South Australian, Victorian and Queensland governments that have sent us flood rescue experts, which is what we need. So at the moment it's still very much a crisis situation in making sure people are safe whilst the rainfall is here. Once the rainfall subsides and the real clean-up starts, that's when we may need ADF assistance, and I've already had those conversations with the Prime Minister to say if we do need that, he's said that he'd be willing to provide that support. So it's an evolving situation. If we need their support, of course we'll ask for it. My suspicion is we will, given the extent of the recovery, but we need to know that even when the rain stops, that's obviously, it'll be a relief once the rain stops, but not a relief for people who have to rebuild their lives, who've got to, who've lost all their positions and lost their homes. That's when the recovery starts, and all too frequently in recent times we're aware that often the recovery is even more challenging than the crisis and the rescue. So we have no illusions about how difficult the next few weeks and months will be, and that's when we will need all hands on deck, including ADF support in terms of that initial clean-up and recovery stage. And as I said, I've had quite a few conversations with the Prime Minister about that. I've had messages from other state governments in relation to their support, which we're grateful for. But in this instance, while the rain is still falling, our immediate priority is to save lives and save property as much as possible, and to make sure people have adequate warning to keep safe, and also to try and do everything we can in daylight hours. It's much more concerning to have to ask people to leave their homes in the darkness. So obviously at the moment it's a process of being more cautious. But you know, one bit of good news was Commissioner York advised me just before this press conference that some communities in the mid-north coast have been allowed to go back to their homes. So whilst there are evacuation orders and people in the main are being asked to leave, there are some other communities where the risk has been assumed to have passed and they're allowed back into their homes. So we do ask people for their patience. When you ask to be evacuated, please know that it's for your own safety. And as soon as we're able to say your home is safe to go back to, that will allow you to do that. Even if people's homes are damaged, we know how important it is for them to feel they can go back to their homes when they can. And as soon as it's safe to do so, we will do that. So I was pleased to at least get that one bit of good news, where some communities have been allowed to go back. But that doesn't take away from how serious the situation is, how evolving it is. And unfortunately, we're not through the worst of it potentially. And that's why we need to brace ourselves for what will be a very difficult week. And then very difficult weeks and months in the recovery.
Premier, we're also still in this situation and it's still evolving, but have you got any sense of what the clean-up and recovery is going to cost? Any sort of dollar amount?
Oh, at this stage, what Resilience New South Wales does to support our agencies is often you can't go in and make those assessments until the crisis is over. So can I stress the priority right here and now is getting people out safely from their homes and saving as many people and obviously lives and as property as much as possible. Although unlike a bushfire, it's very difficult to mitigate against, once the waters come, the damage is done. But can I say that in relation to saving lives, I'm so relieved. I don't want to jinx, but until this point in time, no one has lost their lives, which is pretty much a miracle given what we've been through. And we really want to maintain that.
What sort of funding relief is being offered at this stage to people? Is there disaster funds available?
Yeah, there are. Last I looked, there were 38 areas which had been declared disaster areas, and so you can claim $1,000 per adult and $400 per child. If you need any information, obviously the federal government has information through their website, but we also have it through Service New South Wales. And also support is offered for local government during these times. There are also interest-free loans available, and although we understand that when you're in a crisis, you're not thinking about that, you're just thinking about how you can keep your family together and keep them safe. So we know that direct payment is what's really useful for people, and if you're feeling lost or don't know how to get that information or that, please contact Service New South Wales and they'll be able to direct you to where you need to go.
The federal government's confirmed the delays to delivery of some vaccines. How concerned are you that this crisis is going to put it off track completely?
Yeah, no, I'm not concerned about New South Wales in that regard at all. Of course, there is some disruption, but as far as the New South Wales government is concerned, all of the 5 city-based hubs here in Sydney are all functioning. We appreciate that perhaps for some people, depending on where they live, it might be difficult for them to access the vaccine, but as far as we're concerned, our 5 centres, Nepean, Liverpool, Westmead, St George and Hornsby are all up and running, and in the regions, places like Dubbo and other places where they're not flood affected, they're all functioning as well. Of course, in those coastal communities where we had anticipated to set up hubs, they'll be delayed, but I'm not overly concerned about that. I think we'll be able to catch that up. And what is also a priority for us is not just getting our quarantine workers vaccinated, but also their families, and that's already started. Most of those people live in and around Sydney, which isn't they live in parts of Sydney which isn't flood impacted at this stage, so it's safe for them to come and access the vaccine. So it's important for us to know, as far as the state government rollout is concerned, we're still making sure that people can access those services. But again, the proviso there is don't leave your community or your home if it's not safe to do so. But if it is, by all means, come and get vaccinated. Make sure you come forward and get tested if you have symptoms. So for those of us who aren't directly impacted, yes, the weather conditions are severe, be safe on the roads. But I know a lot of people are working from home today and therefore the roads are less congested. Ironically, it allows for emergency services vehicles to access them and also for people who need to get around their business. Can I also thank the Department of Education Minister, there are 200 schools which are closed today, about 150 government schools and 50 non-government schools, and some others might be impacted, and we just extend our gratitude to them and also to the parents who are obviously having to find alternative arrangements during these times.
Does it though add to your argument that the Commonwealth should accept the offer to keep those hubs operating?
Oh look, I think that's just an ongoing offer, and I think that offer will be accepted. But for us, you know, the next few days are really about saving lives. But having said that, we want New South Wales to continue as much as possible to function in those parts of the state where we can as normally as possible whilst being safe. And so that's why I want to assure people that if you live in a community where you can safely go and access the vaccine, please do so. If you are able to get a COVID test, if you have symptoms and safely, please do so. But obviously our thoughts are with those parts of the community which are still being inundated with heavy rain and who are still concerned about their livelihoods and their property.
What's your latest advice on when you're expecting, especially on the mid-north coast, for the water levels to recede? Because we know in past it can stay around for weeks.
Exactly, but the difficulty is we're still expecting heavy rain in the next few days, so we can't make those predictions right at this minute. I'll have a better idea tomorrow morning when we have all the state leaders together giving me an update on every part of the state. But what I do know today is there is concern about the levee banks up at Kempsey, and that's a concern. The heavy rain will continue in some parts of the mid-north coast and north coast. The rain has slowed down. In other parts, it hasn't. And the water is rising, and so they're the areas we're watching. Similarly, obviously, parts of Nepean and Hawkesbury are still very concerning to us. And as I said, the storm fronts moved south, and Illawarra and South Coast could also be impacted.
Just in terms of the Hawkesbury and Nepean, what you've focused on, it seems that the threat's no longer so much focused on Penrith. Is it more downstream? Is it Windsor?
Yeah, Windsor is definitely a concern for us. The township of Windsor is a big concern, but all those regions are still on a watch and alert state, and again it depends on how heavy the rainfall is and where the water flows are going. And obviously we just ask for people in those communities to be alert and to please follow instructions. And the feedback I've had so far is that people have been extremely cooperative and obliging, because it's very difficult to say to someone who might live in a flood-prone area, this is different to what you've experienced before, but that is exactly the message. What we're going through now is not anything we've seen for at least 50 or 60 years. In some parts of the state on the mid-north coast, I'm told parts of the mid-north coast are experiencing 1 in 100 year events. So this is different to what we've experienced before. It is bigger than what we've experienced before, and we please ask people, please don't be complacent. If you've been asked to pack your goods and be on alert and evacuate, please follow instructions, because it is not the same as what you may have been experienced before. You may have heard this 5 years ago or 10 years ago and your house was okay, but this is an event which far exceeds what's occurred in the last 50 or 60 years, so please be on notice.
The Windsor Bridge was underwater yesterday. Wasn't the new bridge supposed to be impervious to flooding?
Well, obviously, I don't know to what level of imperviousness it was built, but clearly, as I said, in some parts of the state, it's a 1 in 50 year and potentially exceeding those expectations. And we need to be mindful that there are flood-prone parts of our state where people live and work. And we need to make sure that we're doing everything we can to mitigate that. But when you have an event that doesn't happen every 60 or 50 years, that does put things into perspective. And as I said, in some parts of the state, an event which occurs every century really changes conditions about what is normal.
The new side of
Ask your questions, please.
Parramatta Powerhouse flooded too.
No, can I dispute that strenuously? That site is covered for a 1 in 1,000 year event. I will ask Dr. Lee, who's the member for Parramatta, as a local resident, to speak about that.
Yeah, thank you, Premier. Can I just say it's absolutely misleading by those claiming these spurious allegations. The powerhouse is built above the 1 in 1,000 year flood level. It is above most of the CBD. The collection is safe. The museum will be safe. Those misguided people should actually look at the engineering. We've spent a lot of time, a lot of money, and actually going to deliver a world-class powerhouse museum for the people of Western Sydney that they deserve.
The actual site though itself is flooded though, is it?
Well, down the bottom, I was there yesterday, and obviously right along the river floods, it's a river. We've had, 1 in 10 year flood. Of course, there's a little bit of water there, but the level, we have a 68-storey building right next to the powerhouse. it's 5 metres up. You just walk and have a look and you see it's not flooded. We can build things in the right out of the water. It is in the 1 in 1,000 year. It's above that level. It should be clear that it's not in the 1 in 10 or 1 in 100. It's 1 in 1,000, and people are misguided saying it's going to flood.
Yep.
Just, we're here at Westmead for a brand new opening, but obviously there've been a lot of calls for a palliative care ward to be brought here to Westmead and perhaps included as part of the development. Where do you stand on the needs for a palliative care unit, specialised unit?
Look, first of all, can I just say again, this is the most amazing $1 billion development, and it has incredible facilities for the people of Western Sydney. It also has shared imaging services with the children's ward, and of course we've completed stage 1 of the children's new children's facilities, and we've announced that we're building stage 2 as well. So there's a lot of work going on here. In terms of palliative care, Westmead currently does have beds dedicated to palliative care, and I have also visited that particular unit. What I have indicated is that as the building work goes forward and there's more work to be done on this site, that I'd like to see some more work being done in terms of more work for palliative care, but that's part and parcel of what our government has been doing across the state. We've spent an unprecedented amount of money on palliative care, and I think obviously it's a network facility here in the West. We've got facilities, most amazing facilities at Mount Druitt. We have beds here, but what we're looking to do is to try and upgrade those facilities for families to have a more comfortable existence when they're looking after their loved ones at the end stage of their life. But I did visit last Monday week and had a look at the facilities here. They definitely have dedicated palliative care beds, but I'm asking.
People say that the 7 beds aren't actually dedicated to palliative care.
What I've indicated to New South Wales Health is I'd like to look at what other services we can provide in a more holistic and comprehensive way as the development goes on.
So very quickly, just the outpatient clinics, there's some issues around people not being able to get in, especially here at Westmead.
Which particular clinic?
The urology clinic.
Look, I'll ask Professor Broome, Andrew Broome, just to comment on that. Would you like to just give us a quick update on that?
We provide a very extensive urology service to the district. We prioritise access to our outpatients on those people with serious and life-threatening illnesses, and it's about prioritisation. Most of our clinics are specialist clinics. We run clinics for prostate cancer, for bladder cancer, for people who've got potential diagnosis of those 2 diseases, and we have to prioritise them so that people who've got life-threatening diseases aren't displaced by people with less threatening diseases.
Thank you, everybody.
Premier, can we just ask Premier quickly about... It's a big sort of day, the GP rollout, you're not responsible for it. Are you confident, though, that it will go well? Because there are GP clinics in New South Wales that will start giving the jab today.
Look, I think that it's a 1 in 100 year pandemic. The federal government is doing their very best to provide vaccines, which as late as August, September last year, we weren't even sure that we would get the vaccines at all, any vaccines. So I think we have to just give ourselves a little bit of time and work through it. GPs are obviously being notified if they are in the first group. The Federal Minister, Greg Hunt, has confirmed to all state ministers that they're obviously working on expanding the number of GPs as more vaccine comes on board. And I can say the New South Wales senior health officials have been meeting with and working with the federal senior health officials to make sure that there's more work done in the rollout through better co-design. So I'm quite confident that we will get there, but I just think we've got to give people a little bit of space. Can I also just acknowledge Richard Alcock and the board? I didn't acknowledge that earlier, and I just want to say thank you to Richard, thank you to all of the board. To have a vision like this takes people with great vision, great insight into what is needed for decades ahead. So thank you to the board for working with particularly the University of Sydney. The University of Sydney has committed $500 million over the next 35 years, which just shows the university's commitment to research and the importance of research to getting the best possible medical outcomes for patients in Western Sydney. So again, thank you to the University of Sydney, thank you to all the health staff who brought this together, and I think we're now going to officially unveil, or the Premier is going to officially... Oh, will I? Oh, there you go.
Take off.
So,
Thank you,
oh,
everyone.
Premier, can we ask you about the dam just quickly? We we are walking a tightrope at Warragam.
Very quickly, I'm sorry.
It was a
Last one.
Yeah, sorry, that's okay.
It's a tightrope out of Warragam, but we wanted water and now we've got too much. So what's the message to those communities?
Oh, look, this is the absolute irony. We were going through a deep, deep drought where we were concerned about water levels, and now we've got the opposite problem. But can I say to everybody, the rainfall we're experiencing now is in excess of anything anyone could have predicted. And we're doing all we can to keep properties safe and people safe, of course. Thank you.
Thank you, everybody.
Thanks.
Okay, now we're just officially unfolded. Can I ask, yes, thank you, Premier, for looking after, thank you, look after state and we'll look after you unfold. Richard, could you come out, Belinda? Chancellor Belinda? Richard? And Graham Loy? Where's Graham? Yes, sorry. And the Secretary, Elizabeth Cough. Without her, we wouldn't get any money. Come on out. And Catherine, please.